Hi, my name is Jennifer Wittick. I'm a physical therapist. A physical therapist works with patients in helping them to regain mobility and independence after an injury or an illness. Much of my time as a therapist is spent working with patients on transfers. By a transfer, I mean just moving from one surface to another. This could be from a bed to a wheelchair, from a wheelchair to a commode, from a wheelchair to a toilet. But transfers are very important, and as a caregiver, you also will spend much time helping patients to do transfers. And that's why this particular video is on different types of transfer techniques and different types of transfers that can be used depending on the patient's abilities. Now, it wouldn't be right to do a transfer video without talking about body mechanics. So even though you've probably heard this many times, it's very important to have good body mechanics when you're transferring or lifting patients. By body mechanics, I mean that the way that you position and use your body to perform a movement or an activity is very important for not straining your back and for keeping yourself healthy and safe, as well as your patient. For body mechanics, there's many things involved, but I'm basically just going to review 4 important things for you. Now I'd like to just demonstrate for you a few of those body mechanics that are very important when you're transferring a patient. Number 1 is to make sure that you keep your feet apart. You want to have a wide base of support because that's where you're going to get your most balance and stability when you're transferring somebody. Secondly, you want to make sure that when you lift an object that you bend your knees and keep your back straight. When you bend your knees, that helps you to use your stronger leg muscles to do the work. And when you keep your back straight, it helps to prevent you from using the weaker back muscles to do the work. Third, you want to remember to keep the object or the weight close to you. If it's out here, you can see how you're having to strain and flex and bend your back, and that puts strain on it. If you keep the object close, you're keeping it right in with your center of gravity and making the job easier. And finally, and very importantly, remember that when you transfer a patient, you always want to keep your feet pointed in the direction of the weight. So if I start out with the transfer this way, I don't ever want to do a twisting motion where the weight ends up over here and my feet are pointed that way. Many injuries happen when it's a twisting type injury, and I know that sometimes it seems quicker and faster to just transfer a patient like that and think you're going to do one quick movement, but it's really not worth it because back injuries, remember, can last a lifetime, can put an end to this type of a career. So take really good care of your back and just make sure that you're always thinking about what position you're in and the type of position that you're placing your equipment in. You don't want to be in awkward positions. You want to allow for as much space around you as possible when you're doing a transfer. If you use good body mechanics, you should be able to perform these transfers often and with good safety. And just remember, if you hear some lessons on body mechanics and back care again, just be patient because repetition in this area is very, very important. Next, I'd like to just quickly mention a few safety considerations during transfers. You need to always be aware of what your patient's abilities are before you transfer them or their disabilities. You also need to have any equipment, supplies, or any assistance that you need ready for the transfer before you get there and actually start transferring the patient. If they need a certain chair adjusted, if they need certain shoes or clothing on, make sure that you've got that so you don't have to leave the patient midway through a transfer and grab extra supplies. Always inspect your equipment. When you go in, do a quick inspection and make sure that the wheelchair brakes actually work and that when you get your patient into the chair, it's not going to slide away from underneath them. Make sure if you're doing some type of a mechanical lift transfer that the sling isn't ripped or torn. Just kind of do a visual inspection and make sure things are working properly. With transfers, you also want to make sure that you have your surfaces as level and even as possible. That's good safety for yourself and your patient. You won't have to work extra hard to get them up onto a bed from a lower chair or onto a commode where you haven't properly adjusted the legs. So check to make sure surfaces are level as much as possible. Wheelchairs always need to be locked. That's very important. As a therapist, that's been ingrained in me, and I know sometimes when I go into a facility, they tend to put the wheelchair up against the patient's bed when they're napping or resting, and if I'm in there working with them, I'm always clicking those brakes on, and I know that sometimes the caregivers come in and they might be a little annoyed because they're always trying to move the chair and it's always locked, and I'm sure they know that it's me who's been there, but that's important. I would just say lock them and get in a habit of doing that. If that patient for some reason would get up confused or try to get into their chair from bed, it may not be safe having them do that, but you can't always prevent that. And at least if the chair is locked, it's not going to scoot away and they won't end up on the floor in the process. Also be aware that if you're transferring a patient into another chair that's not a wheelchair and that doesn't have brakes, if at all possible, push that chair up against a wall or a secure surface so that when they transfer into that chair, a lot of times they will lean back against it, put their weight against it, or many times they kind of plop into the chair. And if it's not firmly or securely against a surface, the chair can slide away also. Leg rests and arm rests, it's important to be aware of those. Arm rests don't always need to be removed, but in certain transfers they will need to be. Leg rests, almost 100% of the time, will need to be removed. It's usually a good idea. There's no reason to have a leg rest on when you're trying to move a patient. They just get in the way and cause some safety concerns. Make sure that the patient has the proper clothing they need, that they have shoes on and not slippers, that their shoes are not high heels or slippery flats. Just make sure they've got something there that has some kind of a non-skid sole that won't slide out from them when you're transferring them. And as far as clothes, that they have clothes that are not dragging when you get them up. Be aware that a lot of these patients have been ill for a while. Sometimes you will find that your patient, the only pants that this gentleman has are 4 sizes too big because he's been ill and he's lost a lot of weight. And when you put these on him when he's in bed, you may not realize it. And the minute he stands up, they're around his ankles. So not safe and not very comfortable for the patient when that happens. You'll have to just make adjustments for that. Maybe put a belt around them a little tighter. Make sure that they're secure. And I'd like to also mention that holds true for the Depends garments or the Depends diapers that patients wear. Too many times I've been walking behind somebody in a hall and seeing one of these residents walking, and as their Depends is shimmying down their hips and down their legs, and then to their surprise and everyone else's, around their ankles. They're usually very embarrassed, and it's something that can be prevented. When they were transferred into their chair, it only takes a second to make sure that those are on securely. If the tapes are loose, put a new pair on that's going to have tapes that will adhere and stay on the patient. And finally, for considerations, remember to always explain to your patient what you're doing with them. Make sure that you're telling them why you're there, who you are. Reminders are fine. These people don't mind that you tell them repeatedly what you're doing or remind them who you are. Many times they've forgotten from time to time anyway. So the reminder is very helpful and it's reassuring to them. As you transfer them, tell them each step of the way what you're doing, and make sure that you ask for their help so that they feel useful and needed, and also that you're encouraging them to use the abilities that they have.